If you get your health insurance through your job, some changes could be coming that affect what's covered in your plan. There's been a lot of buzz in Washington about changes the Trump administration wants to make to plans available on the health insurance marketplace. But people who get their coverage as an employment benefit could be affected too. Joining me now is Rich Daly, a senior editor at the Healthcare Financial Management Association. Rich, I have job-based coverage. I know a lot of folks watching do. I'm very curious about this. We've been hearing a lot about a conversation around the Affordable Care Act, but this is a little different. Why is job-based coverage part of the conversation right now?
Well, most Americans get their insurance through their jobs. This is about 160 million Americans who either get their own coverage or their kids' coverage through their work. But the cost of a commercial insurance, as it's called, has reached historic highs. Per employee insurance costs are projected to surpass an average of $16,000 this year. But even after the premium is paid, half of American families still owe average deductibles of $4,000 to $6,000. These got to be paid before a penny of insurance actually starts covering anything.
Cheaper health insurance does certainly sound appealing, I'm sure, to a lot of people. What are some of the changes that could make it less expensive?
Well, one big change would be to modify the package of services that employers are required to cover under federal law. These are called essential health benefits. They're required by the Affordable Care Act, also known as Obamacare. But they're costly, and they can include things people may not want to pay for. An example of that is maternity coverage for a postmenopausal woman.
So let me ask you this. You gave the example of maternity coverage for a woman who will never, ever need it, right? That certainly seems like a no-brainer. What about other services that could be cut that people might want? What should you be aware of right now?
It's a trade-off. So if there are less things that they're required to cover, then they may drop coverage of some things that some employees want. So if these changes go through, employees should make sure to track their own employer's coverage to see, next year, are there coverage changes that drop something that they were counting on?
This is definitely something employees are going to want to follow up on should changes arise. We, of course, will be watching as well. Rich Daly, thank you so much for joining me today.
Thank you for having me.